the first session. May I please request the second session members to be ready. The second session is on understanding the synergies between health and sanitation. This session will focus on how sanitation is an integral part of health programs and the health benefits of sanitation. I will kindly invite the next set of experts, Mr. Anand Rudra from USAID. Mr. Anand Rudra is a development specialist with hands-on experience in urban development and public health, has been a keen player in USAID India's efforts on water and urban health portfolio. Mr. Anand? Our next panel member is Mohini Daljit Singh, from Max India Foundation. Ms. Mohini Daljit Singh is an educationist and a social worker. She has spent more than 3 decades in social welfare, is presently the CEO of Max India Foundation, and has reached out to an astounding number of beneficiaries through the foundation. Joining in the discussion is Ms. Poonam Mutreja. Poonam Mutreja presently serving as the Executive Director at the Population Foundation of India, with an extensive experience in the socio-developmental sector, especially in the field of women's health, and has been a member of the Family Planning 2020 reference group. We also have Mr. Krishnan Hariharan from Dasra. Krishnan Hariharan is the project lead for the Gates Foundation Water and Sanitation Program at Dasra. He has previously been a member of National Economic Research Associates. And our very own Ravi Bhatnagar from RB. Ravi Bhatnagar is the Global Public Health and Public Affairs professional, currently heading the External Affairs and Partnerships for Reckitt Benckiser India. He has been instrumental in developing and delivering the very successful Dettol Banega Swachh Bharat campaign. And moderating our session is Mr. Neeraj Jain. Mr. Neeraj Jain is at present the country program leader at PATH with an exceptional experience in promoting safe water, sanitation, and hygiene in child health. Thank you, panel members. May I please request Mr. Neeraj Jain to initiate the discussion. Thank you, audience.
Very good afternoon to all of you. I think this is, they always say that the session after lunch is a great one because most people have either eaten too much and are a little sleepy, so they don't listen to what you're saying. So you can actually get away with whatever you want to say. For the panelists, that's a cue for you. But we'll try and wake you up. We'll try and be a little controversial. We'll try and ask some difficult questions, some easy ones. And I'm also hoping the panel members will work with me. It's a great panel, all old friends. So it's really nice to have all of you here. I just want to go back to a very interesting story. When I started working in the water sanitation space and I went for my first public meeting in a small Gram Panchayat, there was a man who must have been about 30, 35, and we were trying to explain the benefits of sanitation. And we said, if you practice safe sanitation, it will lead to better health. And he looked at me very unbelievingly and he said, you know what, I'm fine. I haven't had a health problem. I go out every day. My dad did the same. So did my grandfather, and we've all lived fine. So, what's the connection between sanitation or, defecating in a single point versus health? So it was an interesting conversation. I must say I got a bit stumped, and I didn't have too many answers at that point. I learned over the years of how to deal with that question. But I think, it's an interesting conversation to have because health kind of covers multiple areas. I don't know if some of you are aware, but across the world, sanitation as a government department sits under the Ministry of Health. So it's always considered to be part of health. And it's only in our country that we've kind of separated it. More so because the problem was so large that the government probably decided that this needs special attention. I also, I'd like to request the panelists, I'm going to start shooting some questions at all of you. So I won't give you any chance to do an opening statement. Unfortunately, we don't have the time for that. But I'd also request you to keep the answers brief, to the point, quick, come back with some interesting ideas. Think about things that have been achieved and where the gaps are. It's a very interesting way to look at health because I work in the health sector. And most of the time we look at health from a curative perspective. You know, how are we going to fix somebody who has diarrhea? How are we going to deal with that? What is going to be, where are we going to take them? How's the healthcare facility going to support that? Or we look at it from a perspective of vaccines, that, you know, can we actually administer a vaccine for preventing diarrhea, preventing water and sanitation related diseases. But actually, the real solution lies in safe sanitation. And I think we probably would agree on the panel on that, would you? Yes, thank you. Thanks. That's very heartening to hear. So sanitation really, if we are able to achieve what we are able to achieve, I joke with my fellow colleagues in my office, and I say, you know what, if sanitation gets properly achieved, we may not have a job, at least in the diarrheal diseases space, and the job might get done by sanitation. Okay, I'll now move to the questions, and Poonam is sitting right next to me, and I'm going to start with Poonam. Poonam, you know, you've been in the sector for many years, a few decades now. And you've done some great work, and I don't want to delve too much on that. But my question to you is that how do you connect sanitation with health and well-being? And what do you think is going to be the impact of that? And what are the things that are still missing that we need to sort of work around? So if you could talk a little bit about that, impact on health and what's happening.
So one of the biggest gaps in India's public health, both in the private sector and public sector, has been the lack of attention to preventive and promotive health. And that's why we have actually not focused on, in the past and in the first 50, 60 years of our health programs, on sanitation effectively and prevention and promotion. I believe 50% of the disease burden in India will decrease with water, sanitation, and hygienic practices and care. Much of it is about changing behaviors, and we have not at all invested in that. We have not even shared the consequences. India is a country rich with very rich demographic data, census data that tells us so much, and there are many other, DHL and so on, you could list out NSSO and so on, but here, health related, there are 5 national health surveys which tell us very clearly what the issue is, what the problem is, where we've missed out. Second, children's health. I mean, you know, the economists in the 90s came out with the Asian enigma. And frankly, the lack of improvements in dealing with child malnutrition, undernutrition, stunting, especially the word Asian enigma was coined when we discovered that Indian kids have much lower, are much worse, 50% worse in stunting than sub-Saharan Africa, which is poorer than India or poorer than even per the family incomes. And we found that it is everything to do with the fact that Indian kids suffer from huge burden of diarrhea and diseases, tapeworm, need deworming because of open defecation. So I don't know why it took us, you know, global and Indian economists to figure out over several decades. It's a total failure of us connecting. And it's staring at you at the face. And now we have data to show. In Calcutta, there's a study which shows that if you just intervene on hygienic practice plus water availability, wash, sanitation, open defecation reduced, you didn't need to even give substitute supplements to kids. And finally, gender. Women are at the worst brunt in terms of health. I'm not going to talk about sexual abuse, safety attacks, and so on. That's one part of the story, but that's mental health, of course. Why should women live with fear, don't have the freedom to step out, and so on? But in terms of maternal health, and child health. Pregnant women, in fact, hesitate more, who should be having more nutrition, more food, more water, hesitate to have enough supplements because they do not supplements, I'll call them what they rightfully should eat, because they cannot go out for open defecation in the daytime. They cannot go step out. So there has been huge correlation in morbidity as well as mortality. Maternal mortality and women producing, as we were discussing, undernourished children girls end up producing. So it's a vicious cycle that goes on. So it is not just about women's health and diarrhea. Health, hygiene, sanitation, all these issues, and we have to talk about education and hygiene information. So if you do that, India's GDP growth will be better, not just health. So I think this is a great thing for all of us to be onto. I'm glad to be part of it.
Fantastic. Thank you, Poonam. So the Asian enigma, and Poonam, you and I both work in the health sector, so probably we'll both be out of a job soon if sanitation works, which is great, huh? And so will a lot of the pharma companies, a lot of the organizations who are producing vaccines.
Economists, without getting it, still are in jobs.
That's true, actually. We'll find something else to do. But thank you so much, Poonam. I'm going to move to Mohini, because one of the areas that completely foxes me, and I don't know, I'm going to ask the audience, has anybody been to a primary healthcare center and used the toilet? Can I see a show of hands? Okay, what about a district hospital and been to a toilet? So probably more, right? And so if you go into any public health facility, actually you go into any health facility.
If it's functional, first.
I was going to ask that question. If you go into any health facility, one of the big challenges we find is with the lack of sanitation. Poonam just talked about the fact that sanitation is critical for health, and then you go into a health facility and there is an issue of access to decent, sanitation facilities. What is your take on that? What do you think is happening here, and what are the solutions that you could recommend to probably deal with something like that?
Right. So Neeraj, first of all, it's health, right? And though Poonam mentioned that, we've just woken up to sanitation, but the fact is that as a country, we even woke up to health at a very late stage. It was only in the late, I think 59 or something, that health even became a subject of consideration. So we are very far back. Let's not delude ourselves. And certainly sanitation is a very important part of health. Now, I just want to give you my background. As Max India Foundation, our work has been totally focused on healthcare for the underprivileged in its 360 degree, starting with preventive, with health education, that's awareness, preventive through vaccinations. There's a big gap in the government delivery. And screening through camps, screening even for things like cancer and all that, having regular health camps, then also facilitating surgeries and treatments. Now, I just want to answer all your questions through a small example. 5 years back, we decided to adopt, among others, a large village cluster in Uttarakhand, Dhakrani, which is quite underprivileged, has a mix of, 50% of, population, the demographic. So obviously, wherever we go, it's health. But what is the first thing I did? Two things I did absolutely first. One was waste management. Even the local MLA did not know where to throw the garbage. I went to him, I told him, I've bought a tractor trolley. Abhi kahan dalna hai, aap batao. He says, waise to koi jagah nahi hai. I said, what do you mean? You better have a jagah. Anyways, it's another story, but we started that. And I had visited in Punjab a very interesting project where there were some NRIs who had come into their villages and actually funded and created a complete sanitation project. That is with connecting every single toilet to underground sewage pipes to STPs. That image remained, and I thought to myself, we are doing a multi-speciality camp every single month through the Max Hospital, Dehradun. We are doing 2 camps per week through another NGO we had taken on, Bella Healthcare, where we were funding entirely the doctor's salaries, the medicines, the diagnostics. So the village was, twice a week and once a month for her. But what will we leave behind as a legacy? Health, what do you leave? You can leave a healthy population, hopefully. So I decided to bring that sanitation project to Dhakrani. The biggest challenge I faced in my 12 years of Max India Foundation, but I'm really glad we are just in the last 5th phase. 2,300 households, population of over 15,000. Now, our mantra in the village, which if you go there, everywhere there are boards, is we started from day one. Swachh raho, swasth raho. It was a challenge. All the outside nalis were full of rubbish and plastic. And nobody wanted to do anything about it. And large panchayat, but they insisted they didn't have a single penny even to clean it up, even to have a sweeper. So starting by, getting sweepers, I funded, I said we'll have to start like that, getting sweepers, tractor trolleys, getting the whole sanitation piece, rallies to clean the village. Start with, we sort of backed them up with the school children and the ASHA workers, who, of course, we had to give them some consideration to be a part of it, which is unfortunate, but that's how it is. And, so they all got it into them. And over the years, the most grateful were the women. They said, "Ji, aapne to aake safai kar di." And then, of course, I forgot to tell you, the first thing we did when the waste management was dustbins, 2-color dustbins. And they were supposed to segregate, which still hasn't worked, but I don't blame them because we ourselves are not doing it so well. But yes, they're still using both, and we're trying to get it. Then the other thing they tell me now, as we are in the exit, कि हमारे दवाई का तो बिल्कुल खर्चा खत्म है. Of course, one of the reasons is because we are giving it. At every month, the multi-speciality camp, we are giving the dawai, we are getting them treated, but they are seeing the difference. And it has been really a very difficult journey. Even the toilets, they actually are, firstly, they're hesitant about, not hesitant, they want to be negative about everything you want to introduce. Mostly because the pradhans, the sarpanch and the gram panchayat wants to know what is it for them in their pocket. Itna matlab paisa spend kar rahe ho, itna kuch leke aaye ho. So that was, and if you don't buy the bajri from us at 3 times the cost, we will put bricks in the pipes, we will create ruckus. So anyway, we went through all that, and that has been happening, and I think we're pretty much good. Now I just want to tell you that in the whole village adoption thing, we've spent approximately 15 crore over 5 years, of which 9.5 almost has been for the sanitation project. And I look back at this point, and when we are exiting, that I think we've done a wonderful thing. Having put this in, because interestingly, the town or city, whatever you call it, of Dehradun, simultaneously now they are putting in pipes. Every house just had their own pit. Now to explain to the villagers, which I want to tell everybody, that, some of them said, "Hamare yahan to toilet hai," especially the better ones, the pradhan and all. What did they have? They just had a pit, and they did not know what they were doing to the groundwater. You're poisoning it, because you've got to think of all this. We had to tell them, I used to be very graphic in my description of what terrible things are happening to you and to the children. So right from immunization, alongside the health camps, eye checkups, everyday talk about hand wash, and through Bella Healthcare also. And then some of our, I would say, friends, like these Enactus groups of various colleges like Sri Ram College and Guru Gobind Singh College, those students were making, some kind of hand wash. So I called them over to Dhakrani. I said, you let me see your, you teach them about it and we'll buy some of it from you. So we tried a multi-pronged thing because, again, I believe, swachh raho, swasth raho.
Mohini, I just want to push a little bit on the question that I was asking about.
Okay, sorry, I forgot about that.
No, that's fine. About the healthcare facilities and sanitation.
Okay,
so what's the solution there? From your experience, maybe.
Okay, so most of the cases like Dhakrani didn't have a primary health center. Okay, so they had one 4 kilometers away. I requested the doctor to come there and say, now what happens is that most of the elderly population, they can't reach there, and nobody in the family has the time. Because whenever they came to our camps, they would say, Madam ji, bada dhanyavad, shukriya, क्योंकि लोग तो घर वाले को किसी को टाइम नहीं हमें कहीं ले जाने के लिए. That is one big thing. Same as with the women and children. There they didn't have it. But I'll tell you about another one. I recently visited in Haryana only because we were thinking of that village. The one thing that the whole panchayat told me, ये हमारा इसको primary health center को कुछ करो. I said, क्या करना है? दीवारें गिर रही हैं. Now, the other thing I found in most of these public places, there's no electricity. Because even Anganwadis and all, because so many things we want to do. If I want to put a RO system, there's no electricity. And why? Because then who will pay the bill? So, you know, these are things, this is one of the big solutions. I hope we have a lot of government people here, I don't know. But, you know, we always talk of a very top-down. You know, any project that comes up, you know, how many thousands of crores it will cost and all. But nobody is looking at the down-up. Somebody spoke of Indore. I always look at Singapore. छोटी जगह लो, थोड़ी जगह लो, वहाँ focus करो and look at the small things. If I can do one thing, can the panchayat not pay the electricity bill? Cannot they distribute it among everybody? Nobody wants to pay anything. And last one here, you know, when we started the collection of waste, we gave the dustbins. The MLA told me, I told him I'm going to charge 20 rupees per head. Nahi, madam, 3 mahine ke liye to free. I said, what are you talking? 3 mahine free? Then we'll never be able to charge. I said, nothing doing. I want to increase it to 50 so that it's sustainable. But anyway, they made a racket. I said 20. Lot of people said, no, no, no. I said, all of you smoke. All of you have TVs. And surely you can take out 20. So 20 we managed, but they didn't let us increase it. So basically, nobody wants to pay. They want everything free of cost. I mean, these are my learnings. I may have done it wrong, but that's my learning.
No, great learnings, and I'm hoping that you're going to try and help scale some of this stuff up, because, you know, we're a big country. And I think the theory of equity requires that we're able to spread this as quickly as possible. We've seen health issues, sanitation, since independence and probably before. So I think we need to move quickly. And,
we need to move very quickly with you. Worst in Asia, I think.
Absolutely, absolutely. I'll move on my right to Krishnan. You got some nice catcalls when you were coming up to stage. So there's a high expectation from you, Krishnan. You better live up to it. Krishnan, I'm going to start with talking about fecal sludge management. And I think this morning we heard Param Iyer. And actually, I've known him for a few years since he came into the ministry. And he's never actually talked about fecal sludge management because the twin pit system was the solution. And I was very impressed to see that, you know, he's talking about fecal sludge management, rural, going forward. You know, I think the need for it, we probably all accept and understand that, you know, it needs to be done. But do you have some ideas of how this should be done, what's not working, what's happening? And I'll request you to focus a little bit on rural and then also urban if possible.
Okay, I think we have the wrong person here. Madhu, you want to come up? Okay, I'll try to answer it. I think in terms of in a rural or urban, I can only talk a bit about rural, but since we've been working in urban as well, I think the first thing to point out is when you look at fecal sludge management, it is important to recognize that ODF as an accomplishment is incredible, but to understand that health and sanitation, if you want to actually fulfill the entire process, then treatment of waste becomes as critical, if not more critical. Just by human nature, if you're open defecating, you're not going to the same place over and over again. Once you construct a toilet, you've got actual waste and sludge there. So I think that's where I think the importance is. I was very happy with both Param and even the Mahua, both of them talking a lot about the importance of fecal sludge management, because it is literally a flush and forget problem. And for the poor, again, I think the panelists have said it. When it comes to health and sanitation, the burden is very disproportional for the urban poor and gender. Now, if you keep both those in mind, fecal sludge management is a solution that is at a very localized level, very, very effective. It is a reality that if you look at sewer networks, they take way too long. India is only 30% connected to sewer networks. They're very, very expensive. And as a result, the poor, again, do not have access to treatment of waste. So I think fecal sludge management is a solution that doesn't look at gray water per se. We'll call it out. But I think what's important to recognize is that actual process is both simple, effective, a shorter timeline, and less capital. And I think for a rural perspective, it is important to recognize that this can be a solution. I think that's been a real eye-opener for us, because at an urban level, we know that you do not have enough space and you do not have enough ability to set up a STP far enough away. So FSTPs and FSM as a solution, I think, is the key. I will keep it short, so I'll only say one more thing. I think when it comes to FSM, for it to be actually scalable and effective, it's really about the narrative around sanitation. We really focus very little on the value chain, which is who's transporting your waste, who's treating the waste before we get to waste to profit. I think we're a long way away, but as long as we know that FSM and FSTPs are solutions, and states have put a lot of capital behind it, especially what he had talked about, 450, but it requires the government to step in and provide you land. And then it requires a lot more operators. We have a few here from Thai technocrats. We know SEPT and a few of the partners we work with who have been supported by the foundation have actually been able to implement this. But it is, again, one more thing to keep in mind. If you want FSM or treatment to scale, the supply side is important. We don't have enough people who can actually operate these kind of technologies. And that's an opportunity for gender, for urban poor, jobs, scalability.
You were good. Thank you. Thanks, Krishnan. And, I think, your point about health related to fecal sludge management, absolutely bang on. In fact, what we've found in various studies is that a lot of the health issues in the urban population is really, it's actually affecting the urban poor more than the rural poor. So that's brilliant. Anand, I'll come to you. And, we talk about sanitation, but sanitation by itself is not the end. I want to talk a little bit about hygiene. And, you in your job have done quite a bit. As USAID, you've been supporting a lot of activities. I know Delhi, you had a large program running for a long time, which was health of the urban poor, and lots of work done there. So just to, understand from a hygiene perspective, how important is that? And I know Ravi will be very happy because he's going to sell more soaps, thanks to this conversation, hopefully, Ravi. But could you talk a little bit about hygiene and how that has an impact, and what are the things that we are missing?
Yeah. First of all, I'd like to place on record thanks to IC on inviting us to be part of this panel, and Neeraj, thanks for setting the tone in the beginning. Just to perhaps touch a little bit off the track of the question that you asked, the element of in other places beyond the country that we're speaking, health is connected directly with sanitation because it is housed in the Ministry of Health. Here we're talking of something different. So I think right from the beginning, there is a challenge of how do we attribute each other. If we do sanitation, what are the health benefits? And if we do health, is sanitation an afterthought, or is it something that basically is the reason for what the health outcomes are? So I think...
I think because of the noise behind, so just speaking to the mic.
Did we miss out all the good things I said before?
No, we were lip reading.
So I think overall that connect very nicely pointed out, Neeraj, is a very much integral part of something that we need to perhaps address. And I'm glad that Param and I think in the morning the MOA did address issues holistically, but the connect with the health is critical. Coming back on USAID, water and sanitation and hygiene efforts, we see health as an integral part of whatever we are doing, not only in India, but around the 180 missions around the world. In India, we are fortunate to partner with Madhu's team and BMGF on supporting the government's efforts in the Swachh Bharat mission. And that being a part of the bilateral support, but core effort on the ground is how do we see whatever we do has a health impact and a benefit. Coming down directly to the question that you asked, the component of hygiene. Yes, we see that as a very key part of what the W and the S part in the WASH is leading to. And more times than not, that falls off the radar. And it's even here we are talking of something which we are not basically saying so much openly, but that's something that falls on the radar. From our side, some of the attempts that we have made in the activities that we support, and I would like to just cite just a few to basically make the case. In school wash, for example, in community wash, the others that we're saying. We have seen the efforts of engagement to have better facilities for water and sanitation, leading to some health impacts. But when we basically try to see the results of how educating on adolescent girls and as well as on hygiene part, on menstrual hygiene and other things, can also basically lead to better enrollments in schools and reduce the absenteeism in schools. Those are things that we have seen. But again, we have seen this because it has been an integral and holistic approach of a WASH education program. We have, and I have to admit that we don't have efforts that we are exclusively actually targeting on the hygiene part. And that's one thing which I see is as a point that you're making. We see this as a holistic effort through the water and the sanitation efforts, that this is also an element that we need to basically see how that gets impacted. And I've been fortunate enough also in previous to the current engagement on the water sanitation part of being a support to the ministry when we were trying to shape up the National Urban Health Mission from 2003. And very, very fortunate that in the same dais I'm sitting with Poonam ji, and her team also was very much integral and part of that shaping up. And that used to fox me quite a bit when you're talking with the government and making the health ministry understand that there is this urban water and sanitation component that is also a cause and a reason to be basically delivering what you are doing. And it took how many years? 2003 we started the discussion. We had World Bank with us. We had other donors with us. And in 2013, 10 years, then the National Urban Health Mission rolls out. Great, like the NRHM was already there, but the National Urban Health Mission rolls out. And the key components that we basically had at that time were water and sanitation are key parts of that thing. So again, coming back, and I hope it's not looked as a deviation, but the fact of hygiene, yeah, that's something which has been always taken as a part of the W&S part, and a need of that being exclusively being addressed, perhaps needs to be done more. And from USAID side, we have done what we have shared with you. But I think there's more scope and space to do much more to particularly measure the health impacts.
Thanks, Anand. That was absolutely brilliant, and it's interesting because we don't have too many people from the health sector here. Poonamji, I think is the two of us probably. Yeah, I mean there are not too many people, and we are still operating a little bit in silos. So maybe we need to do something about that too. These silos need to go down. And I don't think as a health professional now, because I came from the water sanitation sector, I do think about it, but I don't think we spend enough time probably working on sanitation as we should. Ravi, I saved the best for last. So I'm going to ask you, so we have another strange thing in our government, and we have, so globally if you look at the Ministry of Health, water sanitation sits under, nutrition sits under. We have a separate ministry which does nutrition, the Women and Child Development, the Ministry of Women and Child Development. And I think there's enough data, and Poonam did sort of allude to it, that there is enough data out there suggesting that our challenges of wasting, stunting, etc., are all related to sanitation and bad water. Could you talk a little bit about this blind spot and sort of say, what do you think we need to do to get out of that?
Thank you, Neeraj. It's a very interesting question, and my journey of last 15 years tells me like there is a very strong correlation between health, nutrition, sanitation, and if I put it in a framework, the framework is the prevent, promote, and treat framework. So if we invest significantly on the prevention and promotion of good health, the out-of-pocket expenditure on treatment will go down tremendously, and that will have the impact on the GDP of the country. There's some very good practices and learnings from various programs which were supported by the Gates Foundation. To mention one, Avahan program and the learnings which you can draw from there, there was a publication which came in 2016 which was titled Use It or Lose It. That was basically on using the data and how you use the data for the call to action. So there are a lot of anecdotal data which is available, and there are some studies which are commissioned in last few years, last 2 years I can say, which are trying to see like what has happened in India particularly, and you do a longitudinal study or randomized controlled trial, you're trying to ascertain certain things and you're trying to prove your hypothesis. But if I see is like, most of the things are too quantitative in nature, we still lack a lot of data on the ethnographic studies. We don't have much of the ethnographic researchers. We don't know the nudge. There are two kinds of nudges based on my learning. One is basically the visual nudges, and second is the audio nudges. Some beautiful work which is done by Poonam and her team through the episode serials and all that, what you are pushing, and you see the recall and reach of that, and the top of mind recall. So somewhere all the programs wants to do something which is there in the silos. People don't come together. This was something very interesting done by the USAID, which was on the point of use of water, POU. So if the point of use of water is taken care of, the diarrheal deaths will go down. It will be impacting, the child mortality and morbidity both. On the second hand, if I see examples from the polio program now, there was something called the underserved strategy of Government of India to reach the last mile, the last cases which came from Howrah and which came from UP, Muradabad. So they were tackled by the underserved strategy, and the learnings are drawn from there, and we do together some work. Third example which comes to my mind is basically the Ebola or the SARS. The power of faith-based leaders, maybe the Hindus, Muslims, Sikhs and all, and how do they influence? So there needs to be an intersection, there needs to be, Google do some very interesting work on called the Google Sprints. They put the people in a room, in 7 days you come up with a UX solution, you roll out in the market on the 15th day, on the 20th day it's with the consumers, and you see it's failing or it's succeeding. So if we have the fast track, if we can fast track the programs where there is a convergence between health, hygiene, sanitation, nutrition, it will be, it will lead to further better results. And nutrition itself is not a problem of just with the kids, kids will die because, they are stunted or they are malnourished. Problem is much bigger. I was seeing the Time magazine, on the cover of the Time magazine, it was written that the age of this child can be 150 years if you tackle the first 1,000 days of the life, which starts with the mom's life also. So if a mom is pregnant and there are repeat pregnancies, and if she is delivering frequently, what is going to happen is she will be having underweight, and an underweight mom will be delivering the underweight child. And if you have a preterm child, the cost to recover the child is very high. So it's all vicious cycle, and mom doesn't eat much, reason being if she has to go poo in the morning and there is no space for that. So where will we go? Where she will go? And many of them work as a farm laborers and working in the geographies where it's really difficult. Third is, there is really some problem on the breastfeeding part also. I must put it on record. So if you see the breastfeeding rates in the first 30 minutes of the child delivery, still there are so many myths and misconceptions which are related to that. And still, I will not say, but I have to say it, but the concept of gripe water. So everyone wants to give the Janam Ghutti instead of the colostrum milk which is given to the kid. So all these problems, they all fit in a triangle of prevent, promote and treat strategies. If this is taken care well and there is a fast tracking program, then things can move really well. Thank you.
Fantastic. Thanks. Prevent, promote, treat, and fail fast. But what I'm hearing from all the panelists is that we need to break these silos, and it's interesting. We're talking about water, sanitation, hygiene. We're talking about, of course, health in general, nutrition, and it's all sort of needs to be broken down. We have 10 minutes. Should I open it up for questions?
One thing,
Yeah,
if
sure.
you don't, when we talk of the very alarming incidence of cancer today and such, that there's a lot of research going on to see how the environment is influencing it. And environment is nothing but what the cleanliness or lack of it, or the lack of sanitation and hygiene
Whatever
around
goes
us,
inside.
and also the polythene.
Sure.
So this is just a thought that I wanted to bring in, it's not just the smaller things like diarrhea. I mean, diarrhea is not small, but
Yeah, I mean,
from there up to cancer.
you'll have a whole room full of people chasing you if you say diarrhea is small.
No,
so.
I won't. I know I won't,
So,
because I'm more into it
Good.
than
So on
any of
that
them
note,
probably.
yeah, do you want to say something?
Yeah.
I just want to say that promotion, treatment, we have some amount of treatment happening, but the cornerstone of prevention and promotion is behavior change. And I think while we may have, BBC's done a soap, we've done the Main Kuch Bhi Kar Sakti Hu, and there are a lot of advertisements, but I think we need to assess how much more we need to invest in changing behaviors, because it's not about only treatment, as you said.
We
it's
also do a
about
lot of
prevention
puppet
and
shows.
promotion.
We do a lot
And-
of puppet shows at camps.
And we have great
So-
opportunities today with the digital media, using the telephone. We know telephone penetration is the deeper, it's spreading very fast. So I think we can have some quick returns in behavior change. And also, I think to say we are in silos, but the worst still, water, sanitation, ministry, nutrition, and health is all different departments. There has to be convergence. There is no choice.
Well, on behavior, I must tell you, I'm a failed parent, because my 11-year-old, every time we sit for dinner and I say, "Haath dhoya," bolta hai, "Nahi dhoya." So, 80% of the time he hasn't washed his hands before he sits on the table. So I'm still working on behavior change. And we've got a big country ahead of us. Yeah. So I'll open it up for quick 2 or 3 questions. If anybody, we've got the gentleman right there, go ahead. And if you have it for a specific individual, please.
No, it's just a comment and a question. The first question is around how to kind of bring WASH and insurance. So you have microfinance. Is there a scope for micro insurance for health? Yeah, where WASH becomes one of the leading kind of a beneficiary. And the other comment was perhaps when we are thinking together around health and WASH, we have to think a bit more holistically across different layers. So one thing is we are saying that definitely the kids will improve their nutrition, we'll have lesser diarrheal rates, so on and so forth, and we'll prevent all that. But then there are other dimensions as well. One which I'm kind of seeing increasingly coming to the fore is that of antimicrobial resistance and its prevention. So if we are able to do through WASH, prevent infections, to that extent antibiotics will be consumed less, India being one of the hotspots of antibiotic resistance, and that problem we will avert becoming a big one in the future. So I think we need to kind of position the health and WASH context in some additional parameters as well.
Yeah, but I think we should also keep in mind that there are lobbies of pharma companies, of medical service providers, of vaccine manufacturers, et cetera, who will sort of push back at some level. But yes, absolutely, your point taken. I think on the micro insurance, does anybody have any idea, or should we leave it for the next debate? Because I don't.
Micro-insurance. So micro-insurance is one area where I think little bit of economic empowerment happens, but changing and empowering the communities has not happened. So it is for those, whether it's self-help groups or big microfinance companies, I think they have to invest in changing social norms and educating people on range of issues and empowering people to think about their health with information.
Ravi, you wanted to say something?
Neeraj, may I?
Yeah.
So you're absolutely right. Linking financing to health insurance is actually a very interesting idea. It has been tried out. Wasn't able to scale much because the challenge was really the manufacturer, the underwriter of insurance, was not interested in, the claim settlement became really hard. So I think now with the government's health insurance scheme, I think there's a much probably better chance of linking the two. But you're right, it's a great idea.
Go on,
It's a very interesting idea on micro insurance. But there are other health instruments which are available in the market and in the India market. So you have a voucher scheme, you have output-based financing, you have input-based financing, you have credit lenders locally available, and in UP and Bihar there are plenty of them. I have personally met many of them, but thing is what you just said, the risk attached is so high, and so therefore people try it and then they fizzle out. If there is some kind of priority sector lending which can be a part of that. A recent example is Ayushman Bharat. It's also catering to some of these things what we are talking. And your first question on the microbial resistance. See, that's also a very interesting phenomena to work on. And now West is largely talking about the germs, the bugs, and are soaps really required, or are sanitizers really required? So there are a lot of discussions happening, and there are a lot of publications which have come in last 3 months in the Lancet and the BMJ, which is the British Medical Journal, on how trends are changing globally and how the new bugs are coming. So we can take it separately also over,
So what are we going to do without Dettol and Lifebuoy? Huh? That's a lovely conversation. I think I've just been told that my oxygen supply is off now, so we need to close the session. Thank you so much. Thank you for coming, and lovely panel. Thank you.
I'd like to once again thank Neeraj for leading us into an amazing time of getting some great highlights from all the panelists on the importance of health and inclusivity in sanitation. Moving on, may I request all those who are present in the room to clap profusely to bring some energy back for this lovely panel. And also, as I announce the next panel, which will focus on public-private partnerships, which will focus on developing FSM as business. So this session will look at focusing on the business of sanitation, the necessary ingredients required to making FSM as a viable business. The session will highlight challenges and policy interventions required, various service delivery models, and technological interventions required to help make sanitation a viable business. So as I start, I would like to welcome the moderator for this session, Ms. Madhu Krishna. Can we all clap and welcome her? Madhu leads BMGF India's initiative on water, sanitation and hygiene. She has been a development professional for over 16 years with a special focus on program design, evaluation, policy and advocacy across public health, livelihoods and women empowerment. We also have Ms. Aloka Majumdar. Aloka is Senior Vice President and Head of Corporate Sustainability for HSBC. Her expertise lies in the fields of education, skills, financial inclusion, environment, and climate change. We also have Mr. Sampath Kumar. He is a director at Tide Technocrat Private Limited and Prakriti Renewable Power Private Limited. We also welcome Ms. Priya Nayak. Okay, I will go ahead announce we have Mr. M. Krishna. He is the MD of Kamaveda Enviro Engineering Private Limited, and his organization also runs through its foundation an amazing set of work with the sanitation workers. We have Priya here. Let's all welcome Priya Nayak. Priya is the founder and CEO of Samita Social Ventures. She is also has worked extensively in the areas of WASH, corporate partnerships, nature conservation, art, education for differently able children, and livelihood generation through micro-enterprise. Over to the panel.
This is on. I hope it's on. Yeah. So good afternoon. You have to go bear through one more session before I suppose we'll get tea. So how many of us are engaged in FSM in some way or the other in the audience? Yeah. So not as many hands as I'd like to see. But how many don't understand what FSM is? Do we have people who don't understand what fecal sludge management is? Anybody? No. So that's amazing. That's great. I know we've been hearing these three words, letters, several times. I'm so happy that both the secretaries talked about FSM, and it's a great journey that India has taken on this because any movement that we do for Swachhata, if it does not have treatment at the end of it, it'll be a half journey and will not, as the earlier panel talked about and Neeraj talked about extensively, not give us the health benefits that we all strive for. So there is no disputing how important it is, and it is also a celebration really of the way that this mission has evolved. We've been working as a foundation quite closely with both rural and urban ministries on the Swachh Bharat mission, and it's been very heartening to see how quickly they have actually absorbed the lessons, the advice, listening to experts and tried to bring that into policy, actually at a speed which I think is quite remarkable. I've never seen that happen. I wish it would happen, like we've discussed in many other sectors, health, nutrition, where also lives are lost, and largely because A, we don't pay enough attention and don't tweak the program to the context of India. But we are very proud to be partners with the government, I would say at this point, because there's really a huge momentum around FSM, and that momentum is not just words and policies, but it's actual money being put behind that. And the government's role is obviously to help create the infrastructure, and everyone else has to come across and provide all of the other pieces of the value chain. And in this sense, I mean both the supply side as well as creating the right behaviors at individual household level. So that's the journey that we are all on. And again, as partners with the India Sanitation Coalition, this has been a moving emphasis of the coalition under the BUMT framework that we've had right from the beginning, that even when we ask people to invest in sanitation, we ask them right from the get-go to look at all pieces of it, not just stop at the build, but to help in the use, help in behavior change campaigns, because that's area necessarily that governments don't have the right skills will always need information and support from civic society as well as from technical partners to tell them how to create those messages. That's not by default a skill of governments to do. Maintenance, I think, is an agenda that, again, as I said this before, the government has actually put money behind it, is thinking about models, and therefore also now the treatment. But what role do we see for the private sector? Because we are sitting in the coalition where our whole effort is to bridge this and make this the platform where corporates can engage with government and vice versa. Well, and how can we support as a coalition? And so today, I want to welcome all of the panelists that we are going to deliberate on where are the gaps and where are the barriers, and how can we make the private sector much more an equal partner, because without their engagement, without their supplying the quality services that the sector needs, we won't be able to make the progress. We've seen it already in the toilet construction, how much of a role there was for private sector players. I think it's even doubly important for FSM. So we have a range of expertise on the panel. They've already been introduced. I don't want to emphasize how privileged I feel to be here at this panel to talk about an issue that I believe is very close to many of us, and we spend a lot of time talking about it. So I'm going to go straight to Aloka, because we know that financing is a big issue. And then I'll come to our entrepreneurs and to Priya, who also helps raise funding for this. So Aloka, I know that you are unique at HSBC, that actually you have been a supporter not only of the build, use, maintain, treat, but specifically for FSM as well. So what brought you from your CSR angle? What interested you? How can we use that? How should we position it for other corporates, banks, etc., to get interested would be my first question. So, yeah.
So thank you, Madhu, and pleasure to be here. I think we have, I was just thinking that, how the journey has been, because we've been part of India Sanitation Coalition now for the last 3 years, and we've been working in this space for quite some time. And we were thinking that it all started with construction, to then generating demand, to then talking about behavior change. And suddenly we see that there's a major shift. And therefore now suddenly it's all about financing. And in all these spaces we are talking about financing. So for construction, generating demand to maintenance, now our programs, we were just taking stock of the programs that we support, and we have partners also in the room. We have SEPT and we have some other partners as well. Our programs are now focusing on facilitating financing for sanitation. And when you say facilitating financing, it's actually a very broad range. It starts from construction, it goes on to maintenance, and now FSM is the very large piece. What we're seeing is actually FSM taking the bulk of or requirement in terms of resources. That's the big requirement that will be for the sector. Because I think once we have achieved ODF or on the verge of achieving ODF in the country, I think the FSM is no more something good to do. Is the biggest challenge that we'll be facing, because we really don't have the required infrastructure. Now, when you talk about financing and to make business, what are the business opportunities? We still feel that there will be requirement of grants. Because I really don't see that grants are going to go immediately. But grants can, I think, play a very big role in creating solutions. So even grants being used to create solutions, financing solutions, is something that is going to take center stage at this point of time. The other thing that we are looking at is that, new models of funding. You have a lot of now talk about impact bonds. Now, there will be, even within grants, I think the grant market is also maturing, or the CSR market is also maturing, is something that we feel. And going forward, we see new modes of funding through CSR grants. The government has already allowed CSR funds to be used for funding incubation, right? So that's going to be one big piece. So there's a lot of evolvement that's happening in this sector. The impact bonds I've already spoken about. I think another thing which we've been struggling, and Vedika is here as well, and we've been talking for a long time, is your revolving fund. There's a huge amount. If you're talking about small enterprises in the sector, the biggest requirement still remains working capital, and that's something, a struggle, I don't know, from the time we've been discussing, that remains a struggle. So therefore, I think the revolving loan as a product is also something which is going to be quite relevant. And if grants can be used for the purpose, I think it can have a major impact and a lasting impact as far as addressing this issue is concerned. So I'll stop here, and then we can come back with other questions.
That's really great, and I'm sure that both the entrepreneurs on both sides will be happy to hear about your thoughts on this. But it'd be great to hear from you, Mr. Krishna Anand. Where do you think the big barriers are? I know you're kind of a front runner in the kind of business that you do and how you have been engaged. But it'd be really nice to see from you where you see the barriers and what you see is the facilitation, because obviously FSM is growing. There's a huge government commitment, at least for the capital expenditure. Some of them are also, looking at how do you do the desludging and how the government should engage in that. So what, in your opinion, would be the best model for you to grow your business, and what are the barriers that you see in that?
Thank you for having me over. We've been around in this ecosystem for a couple of almost decades, and this new shift to FSM is really a welcome change. Two constraints that I genuinely see. At a central top-down level, there is a lot of focus, but if you keep coming down the tire, the central government commitment to the cause, then the state government which implements them, and finally you work with the ULBs. So on a day-to-day basis, you work with the ULBs, and that's an area of challenge. So when somebody invests money, he obviously expects a decent amount of return, and when you work with an ULB, which is reasonably opaque to deal with, there is a huge risk involved. So that's when I think, at the ground level, there is no euphoria. I mean, nobody is really too very keen to put in money because they're scared that after I get into this business, if I don't get paid, like you rightly said, working capital, you can get caught in this vicious cycle. So if that issue can be taken care of, and some kind of a mandate in the contract can be formulated that people get paid month on month, and the final dotting the I's and crossing the T's are left to the ULB to do on an ongoing basis, it becomes a lot more viable. Because without working capital, ultimately this business comes to a grinding halt. We've seen that in the municipal solid waste. There were very, very big players who came into the space and did not get paid, and that machine was standing idle. So that should not be repeated here. That's perhaps the only challenge, and I think going forward, if that can be taken care of, I don't see a problem at all.
You talked about two constraints, but you are thinking it all is one.
Of course, the second is, of course, the actual framework of the contract. We need to have a decent floor price. In India, making profits is a bad word, right? So when you go to the municipality and want to work, they want to keep squeezing you down to the bare minimum in terms of pricing. And if you expect people to come and invest money and time and not make money out of it, I think you're living in some world of your own. So this is another myth that we need to break. If you want guys to come and play in FSM, they need to play there and make money out of it. That's not going to happen because the way the animal works there, the animal there which we work with normally wants to not pay you. The contract says I can terminate it anytime I want to. It's a completely one-way street. So you actually need to be a fool to get into that space.
So Sampath, you're kind of a front runner and very, very big innovator. First of all, congratulations for your prize today, very well deserved. What brought you into FSM, especially with this new technology, and what do you think are some of the barriers you'd like to address to us, how we at the coalition, at the alliance, with individuals here, how can we help you grow your business? Because it's obviously needed desperately.
I'll tell you two things. One is how did I get into this? That is question one. How did I get into this? Question one. And second, what I am seeing at this point of time, trying to do some, we are trying to put up some 20-odd projects in Andhra Pradesh, and what's the kind of experience which we are facing from what you are telling. What got us in, I think, what got us in was the Gates Foundation, frankly. That's the starting point. There was some project there. We started testing out some equipment for the Gates Foundation, and somehow we fell in love. And I always used to do solid waste management. I have done, half my life has been spent doing solid waste management, and I was always a waste man for my daughter and my son, and now I have become a shit man. But that's the difference. So, but that's what has happened. Okay, so that's where we started, and somehow we have fallen in love, and as an organization, we have sort of got into it so deep now. I actually say that, we have now sort of got married. I think for the next 10 to 20 years, we are committed to it, sort of stuff. Our experience in Andhra Pradesh has been a very interesting experience in terms of financing. Very interesting experience we have gone through. When we have gone to the bank, few questions have been thrown at us. This particular contract, interestingly, what was done for Andhra Pradesh was a good contract done by ASCII, very nice contract, very even-handed contract which was done. And with this contract, we won the contract. We went to the bank and said, now fund us. So the first question, and this is basically what they call as you get paid 50% when you complete the project and get 9.5 years. So it's some sort of a hybrid annuity model contract. And we went with this contract to the bank. The bank tells us, first thing, I don't know whether it's a term loan or is it a working capital requirement of yours. Very first question we were thrown. We did not understand what he's talking about, but anyway, that was what was thrown at us. The second question which was thrown is that, after 6 months, you are going to give the equipment back to the municipality. So it's a municipality-owned equipment. So there's no primary security which I hold. So how do I fund you? So I can't fund you. So that's the second question. The third very interesting question which was thrown back by the bank is that I don't trust the government to pay you. It's not what Mr. Krishna says that the government will not pay you. The bank tells me that I don't trust the government to pay you. So there seems to be a very clear policy need from this top level to come down to the banks to say that, yes, these are projects of national importance. You need to trust us. Today morning, I was very happy to hear today saying that under the priority sector lending, there can be a sub-lending for sanitation.
Yes.
If something like this happens, where the banker has his tools. Every banker I have met has told me, I am thrilled with your product. I am convinced that you are competent to deliver this. But do I trust this whole system? And I think that's a bit of a challenge. At this point of time, there is a need for the trust building which has to happen if any entrepreneurship has to happen. So that's, I think, the experience which we have seen over the last 5-6 months. And the consequence of this is that the bigger operators will not come in to start with. People like us who are basically small and slightly above small, who will be actually risking it out, and we will be all risking our absolutely risking ourselves fully if we are committed to this idea, to risking ourselves so badly that if things don't go well for us, not because what we do, but because the systems have not worked well, then there's going to be a big hit. which is not a very great situation to be in for us personally also and for the system also as a whole. That's, I think, the thing which I'm seeing at this point of time.
I'm hoping all the bankers are listening to this in the room are going to help us build this trust because it's super important. And I think it's a message we need to also take to our two secretaries who were here in the morning. Absolutely. Is to say they need to start engaging with bankers and with ULBs, etc., to make sure that we increase that trust. So thanks very much. It's very nice, open, frank feedback. Priya, what are your views? What are the big barriers and how have you seen that playing out?
So honestly, Manu, when we first started taking the FSM conversation to corporates, no one had heard it, right? So they had focused on this sort of madness of constructing the toilets. Then other people said you have to think about maintenance and sort of behavior change. But FSM hadn't even featured in their list of even things that they had heard, let alone priorities. So I think the work that you are doing, the work that the Alliance is doing has been extremely critical in creating that awareness. Right. So sort of point one. Point two is, and I think, going back to what the two of you talked about, which is until you fix the supply side, why will funders come in, right? So the government needs to do a few things about it, right? One is actually incorporate it into policy and talk about it, really create the buzz and the excitement, very much like Swachh Bharat did for toilet construction. The second is also provide opportunities at scale. So if you want serious players to come in, then those opportunities need to be available. They need to be de-risked. The enabling environment for execution needs to be present. The third is really break down FSM into components, right? Yes, you will have a few large players, but you're going to have a lot of small players who might come in and do parts of that entire value chain. And again, communicating those opportunities and ensuring that you are giving corporates the comfort that execution will get done is critical. The second is really the role of implementation partners as well, which is, I think, quality really needs to be looked at. I mean, most of the companies that we deal with have really burnt their hands in the toilet construction phase itself. And we have this sort of strange situation where we now have to go back and take away some of those fears. So I was in a meeting last week where we were pitching to a company who has a very strong commitment to sanitation. MD number one is very excited about it, the guy who sits in Singapore. The guy who sits in India is saying, oh my God, you have no idea how difficult it is. So the fact that we have to help them, get over some of their fears and anxieties is a lot of work, and that's something that implementation partners also need to take responsibility for. The third is actually just factoring in the human element, right? How do you ensure that you're creating solutions where public is also demanding these services and ensuring that this becomes sustainable over a period of time? No company wants to come in and fund something that's not going to get either a form of public ownership or some implementation partner is going to sort of run with it. So I think those two are increasingly critical. Third, the role that the ISC is playing, the Alliance is playing, that you are playing, to ensure that you create not just the buzz around it, but that entire ecosystem of support. And some of that market making needs to happen. The last thing I want to say is that I think there are two kinds of cases that one needs to present to companies. One is a business case, and the second is an impact case. And that has to be done collectively, right? Because we can't sell something unless we know that partners on the ground are also capable of execution and delivery. So what we normally do is, even for FSM, we kind of break it down into 4 components. The question is, what can we do to get players like L&T and Thermax interested in this as a business proposition, right? Which means they have to function at scale, government needs to give them assurance, execution has to be done, standards have to be created. The second is what happens to companies who've already funded sanitation, and FSM becomes now a natural extension of the investments that they would have made. And those are sort of smaller. You're not going to see large commitments, but those are critical to ensure that projects themselves have that FSM component. The third is companies who can be catalytic. You talked about financial institutions. Absolutely, the role of finance is catalytic and critical. But also, for example, can we get transport companies excited about this? Right? Can we get IT companies interested in supporting the government with the infrastructure to manage these complex projects? And then the last is sort of companies who are interested in CSR as a compliance, but who also care about the impact. So can we go to them with a case to say, well, you know, X 100,000 jobs can get created within the entire FSM ecosystem, and that's why instead of just funding construction and, you know, tailoring and whatever else, that this is a sector that is going to grow, and therefore can they start looking at it seriously through, you know, let's say skilling or behavior change or some of the other aspects. So I think, you know, sort of long story short, you need the ecosystem. We need to have all of the partners sort of truly committed to execution. And third, let's create an individual case for why each company should really invest in it. Are we going to see 5,000 companies supporting it? Most likely not. But let's get the top 50, 100 players because their commitment and their long-term commitment is very critical for this journey to be successful.
Yeah, it's a dilemma because it's not large infrastructure projects. It's very decentralized, local, have to be implemented by local ULBs. Citizen engagement is important, but it's really about making sure that there is a supply chain of you know, good sustainable businesses that carry it on. And actually the hook is for the ULBs to implement it. If you do set up the infrastructure, you need to make sure that the municipalities, the ULBs take responsibility to ensure that, you know, sludge comes into those treatment facilities, the desludgers are regulated, households know what their responsibility is. So it does impinge a lot on what ULBs have to take responsibility for. I think much more than if you're thinking about individual household toilets, or even much more on community toilets, where we know there are huge problems of the commons, like nobody really owns that. But in this case, the land is, you know, always going to be likely be always supplied by the municipality. So FSM is a tricky business in that sense, because you can't sometimes get big companies. For them, the transaction cost, it's fragmented. How do I deal with 20 different projects? I mean, Tide is, it's a big, you know, challenge. You have to set up project teams in every location. And it's decentralized. It takes a lot of bandwidth and staff and personnel and a lot of costs. So we have to somehow make it, but we know because the scale is fairly large, right? It's like 5,000 FSTPs in the next 5-6 years in order for us to solve our treatment problems.
Not 5,000. Today, I think Mr. Paramayar was talking of 5,000 towns plus 7,000 large villages. So actually 11,000 numbers.
Yeah, but there you do some clustering because otherwise those are too small. They won't be sustainable. So those are some of the things that I think a lot of partners here are working on. How can you do it? And then of course there are all these administrative boundaries that you have to get over. But on sustainable business, is there other sectors that you have learned which are this kind of fragmented, where somehow still we've got medium sustainable businesses that can see it? I just see it's an attractive, but I also see that there are barriers just because of the nature of the decentralized nature of these solutions.
It's sure a very attractive space. Garbage is almost a parallel to this. So guys who transport garbage are now coming of age, and there are many who came and never came back again. The biggest was Onyx, the French company, part of the large consortium. They played in Chennai for 7 years, and they ran away with the bag and baggage. I mean, they just not to bid again. So that learning is over now. I think the new players that are coming into India are kind of repeat, you know, bidding, and it's kind of happening because they now have a floor price. They have a mechanism where they get paid every month, irrespective of, you know, the bill passing process, which can almost take a year. So I think those are the issues that have got ironed out in the CNT of MSW. Okay. Such kind of norms can be put into this, you know, this part of the tender, because tender building is I think the crux of it. Because once you start getting into an, you know, you go to the municipality and say, hey, where's my money? Then you say open page number 14, line number 3, there's a 4th paragraph which says something. You know, you haven't ever read that in your lifetime. You know, you've signed some 400-book document. So you just get caught there. I mean, you say, oh yeah, I didn't know. So this is where you get, you know, you just lose the battle. So if these can be ironed out and life can be made simple, there'll be far too many guys who are interested. But they just need to, you know, get these things out of the way.
So Aloka, the question comes to you. There's a direct ask for the bankers to show some more, I guess, trust in the government to pay.
Yes. You know, I was just thinking you had a question, then are there other sectors or industries who have gone through it? Now, I'm talking about 2010-11. we were dealing with renewables and energy efficiency. And I remember similar kind of things. Everybody said we don't have products. Then they said that we don't know how to assess risk. Then they said that, lending for 10, 15 years, sorry, we don't have the trust. So therefore, but if today if you see, and if you visit some of the banks, including ours, and I just learned from the business people that energy efficiency financing is actually growing. Like it's one of the biggest focus for the bank today under sustainable finance. So even I was surprised to see that how it has evolved from say 2010 to now. So I think similarly with FSM, it's given that it's an imperative. I mean, nobody can shy away from it. So we're going through this phase where the challenges you're talking about. One of the things that I want to talk about, given that I manage the grants, we've often seen that there is a requirement for guarantees. There's a huge requirement for guarantees when a particular sector is evolving. And I think there is a huge role that fund aid agencies can actually play. So if you're talking about, say, the World Bank, IFCs, and the USAIDs, and there can be, and we are not allowed to use grant funding as guarantees, which we've tried in the past, but I don't think the CSR bill allows you to do that at this point of time. We don't have clarity on that. But I think providing guarantees would also help companies to access this kind of funding, and it becomes easier both because see, from a banker's perspective, I think very few bankers have the bandwidth to build that, to do this on their own. There has to be the forums like, say, the ISC and others can play a big role in terms of creating so the conversation PSL is already on, right? But having said so, I think to start off this entire thing, some of these measures and learning from what we've done in renewables and energy efficiency can be also brought into it. And we can see that whether that works or not. And of course, in our conversation with the government, if a certain portion of the 2% can be used as a guarantee, can also be something that can be explored.
That's an interesting point. I just heard actually from a partner of ours working in UP that they didn't get bids because companies that wanted to bid, they were asked for a large amount of guarantee. And smaller companies were not unwilling or couldn't access that. And as I said, the projects are small and disparate. And even though they tried this cluster approach, the guarantee went up. Yeah. So at one end, it makes sense because as a company, I can bid for 5 or 7. But then my guarantee amount goes up. So it's an interesting point to think about what we have. Priya, any thoughts on that? Do you think corporates might be interested in using CSR funds for this kind of guarantees to small companies and help build up banks' confidence, I think, truly?
Yeah, so actually we're coming up with a report now on innovative financing. I think both aspects, which is from a compliance perspective, how does it function? Because otherwise you can create all of this excitement, goes to the board, and then it gets shot down. So compliance is absolutely a hygiene factor. So ensuring that we are getting legal opinions on how one can structure it. I think Godrej, for example, has tried the guarantee fund model, but for skills. Yeah. So let's use, some of these existing examples also and say if it can be done for skills, it can be done for projects such as these. The second is, I think, sort of 2 parts to it, right? One is, this seems like, something that needs to be co-created. Just our experience has shown that the first set of companies who have to bite the bullet have to be your trusted partners in also walking this journey with you. And so I wouldn't go to 500 to begin with. I would go to maybe 5, 7, 10. Aloka, you've clearly been a pioneer, right? And in a lot of cases, having you at the table helps other companies kind of feel better about it. So really creating this demonstration effect, but also ensuring that we have 5 or 7 people who are walking the path and are helping us answer these questions. A lot of times, Madhu, how people think about compliance, we have very little visibility into, those are boardroom conversations. And therefore, to have those corporate leaders be here and also problem solve along with you is critical. The last thing I want to say is, this whole sort of innovative financing piece also sort of got stimulated with the whole impact bonds conversation. And most people are now looking at it through the lens of, let's say, education or skills or health. But given that this excitement is built up, we had a very sort of strange request from one of the investment banks. And they came in and they said, bank so-and-so has done this. We want to do it bigger, better, shinier. Great. So tap into that opportunity. Because if they want to also distinguish themselves, this is potentially an interesting opportunity to take to them. And the fact that you are at the table, somebody like Aloka is at the table, ISC is at the table, lends a lot of comfort in having those conversations.
Thank you. Great. So we're at the last, I think, 15 minutes. So can we ask for any questions and please direct them to any of the panelists? Do you have questions on FSM, businesses, sustaining business? Do you have any questions for the panelists?
Yep. I'll ask a question.
Yeah.
A topic like developing FSM for business, I think one of the issues is it's really so broad that it feels like an incredibly big challenge. I think we've had these discussions before. When you look at sanitation for India, you forget that UP is the size of Brazil, right? So if you were to look at industries and actually see, instead of saying FSM for business, FSM for certain industries to start with, to see who has the appetite, is that an approach which will actually build this higher? Because we've seen some discussions around tourism, if that becomes an industry, but instead of trying to solve it from a HSBC perspective or a banking perspective, saying FSM for business, could you actually talk a little bit about how would you segment this to say, look, this is the low-hanging fruit, this is the other one? So that's the question.
So Krishnan, a very important and interesting point, which is actually emerging in the CSR space, and particularly as far as HSBC is concerned. As of last year, we have actually started looking at something called sustainable network and entrepreneurship. So which basically looking at supply chain or distribution chain of companies, or even the whole ecosystem of a company. And from that perspective, I think this is an interesting model to see that whether this works, because it's, I would say, the problems are so complex and diverse, and like you said, the states are very, very large. One solution could be, or at least a pilot also could be seen. I was talking to Dinesh and Biraji in the morning, and we were thinking of, you look at a sector. So for example, if you have, this is very hypothetical, and I'm just saying, but if you have a town where you have steel as an industry, and you look at FSM or fecal sludge management from that perspective. So you get all your steel players together, and then you see that how you deal with FSM. That's a thought. It's a very new kind of approach that one is looking at, and I think it's picking up though. And but I definitely think that there is merit in looking into it, because the entire space is so complex. This is one of the models. I'm not saying this is the only model, but perhaps particularly if you are to do demonstration projects, as Priya was mentioning, at times you demonstrate something, it then picks up. And that's a model like this. When you're looking at a sector perspective, you take one sector. You either take, say, hospitality, or you take hospitals for that matter, and then you look at the FSM, managing FSM for that sector in a particular area, and see that what works and what doesn't work. That's an interesting way of looking into it.
Thank you. Yes?
I was a bit concerned because the municipalities seem like the whipping boys, everyone complaining about the local governments and all. And having spent half of my career working with governments at local level, national level, it's not all that bad. I mean, there are good municipalities, there are very good municipalities as well. And I'm just reminded of years ago when I was in NIUA and Meera was in the fire project and with USAID, and we were thinking about municipal bonds. And the first thing that the then secretary in the ministry says that you guys are crazy. Municipalities don't have money even to pay the salaries, and how can you think of bonds? And that was the phase when the Ahmedabad bond came, and then so many others. And solid waste, the same story. Said, how can you get somebody to collect door-to-door waste and then treat it and then generate something out of it? Today, I mean, whether it's Indore, Bhubaneswar, I mean, whatever the second-tier cities are demonstrating. And I think we are at a stage in the FSM space where we have to really identify these sort of municipalities, not just the corporates. I mean, Hopefully there is money there. Hopefully there are bankers like HSBC and others who will support. And I think there are municipalities as well, which are willing to do. And in Maharashtra, in our own work, we have found municipalities that are willing to put their own money into this space. And all your risk aversion, I mean, there are standard frameworks now. We are using in our work the escrow model, where 4 months of payment of the desludging company is kept by the bank in an escrow account. So this money is always available for payment. And in fact, it's the bank that is telling us that, look, these guys have to be paid, so let municipality tell the municipal. So there are mechanisms that we need to explore and that we need to go forward.
Thank you. That's a good positive, leaving it on an optimistic note. Yes, Cheryl.
Yeah, I'm just hoping that the panel can comment on FSM and circular economy, because we talk about waste to wealth, but I think linking some of the conversations about where the demand for the output products would come as particular sectors that could help to finance some of the first cases. And in our case, we're doing some experiments in Assam with the tea sector. So the tea sector came to us wanting solutions for sanitation in the tea gardens, and wanted them to be, of course, cost recovering for their business. And so they're now testing many circular FSM models for the tea gardens, and supported by the Ethical Tea Partnership, bringing those learnings across the sector. And I think mining came up. I think there's other sectors which are similar that have perhaps more risk than some other sectors that may be looking for either the outputs coming out in the form of water in the tea gardens, fertilizers, and energy in other sectors. So that could be another way of creating the right demand and highlighting, or going after those sectors that are particularly at risk.
So I'm going to take the first crack and just say, and I hope I'm talking on behalf of the Alliance. I think we do hear a lot about circular economy and making this sustainable, but I think the main onus for doing this is actually on the government to do the capital infrastructure, right? And the getting the best out of it and making it sustainable business is a second order problem for us. We have 90% of the waste not treated, and largely in the small towns. And as an alliance, as a National Fecal Sludge Septic Management Alliance, we certainly believe that we have to push to get all of that waste treated, first and foremost, and then worry about the sustainable aspect of it, because just by treating it and the kind of solutions that you have on decentralized are very environmentally friendly, much less resource intensive, much less energy intensive, much less water intensive than all of the other solutions, which, by the way, were never asked to be sustainable businesses. So that's our stand on it. Hopefully we get enough. We haven't seen, these are so small, the water, the cost of transporting it out will never pay for that water. And the sludge itself. The quantities are too small for us to try and make sustainable businesses out of the FSTPs. So we're not trying to push that at all right now. And anyway, we should ask those questions for the big STPs. They were never asked these big questions on sustainability. And this is something that municipalities have to do. This is something you owe your citizens, and the citizens should be able to desludge regularly and pay for those services. That's the stand of the Alliance. I'm hoping I'm saying that, but I'm happy to hear if there are other views on the panel.
I completely agree with you. The only thing which possibly, purely from a business perspective for me, I would, if I go to a small town, would like to take responsibility not just for the fecal sludge, but also for the municipal solid waste, because that increases the size of my potential business. But that's something which I still don't understand fully, but that's one possibility which is there. So, but from what Madhu is saying is absolutely correct. If I'm just doing fecal sludge management and I want to make money out of it, I don't think there's any money out of it. It has to be funded by the government at this point of time. At least the capital investment has to come from the government. And I don't think even the operations can be fully funded from the revenues which are going to get generated.
Just a comment on cost recovery, and revenue generation. So, the systems will continue to need funding unless there's some cost recovery. So just something to think about.
With you completely. It will require funding. There's no second thought about it. But the idea is that as a business, I would love to say, okay, can I do something more? Can I make some more money in this? And that's I think the thought process which we are thinking at this point of time purely as a business. But to say that it has to be as of today, maybe in the next 5 years, maybe it will become viable. Maybe I think maybe we should think in that perspective. But at this point of time, are we ready for it? I'm not so sure.
So if we term FSM with the present honeysuckers, which are there in most of the case of municipalities, is there a need of legalizing and regularizing the honeysuckers who are there? And if there is a need, how can we do it? Because that is the part of entrepreneurship and business as well.
Do you want to take that, Mr. Krishna?
I guess there is no framework as of now. You could be a private player who can come by your house and evacuate your sludge. In fact, he doesn't know where to desludge it. He would perhaps, look at the closest place. If nobody's watching, he'll pump it back into your house. If you're not watching. And there is no system really. But then, then the FSTP plant actually comes as a big advantage. You can perhaps go to the nearest plant and then pump out the sludge, and maybe the guy who owns the plant can pay him some money. So, as of now, I really don't know, but there is no structure per se as of now. It's a free-for-all market, and anybody who has a truck can go about charging you some fee and picking up your sludge. And how he would desludge himself, the vehicle is anybody's take.
So to answer your question, there are lots of models that we are now looking at. The first premise, as Mr. Krishna says, is first you have to have the treatment infrastructure, right? Before you start regulating anybody, because they are doing a service, right, for households. So when I was speaking to some state governments, they'll say, how can we regulate them? We don't even know where they should go because we don't have treatment infrastructure. So the first is you should have the treatment infrastructure. And then there are a couple models that municipalities and state governments are following. One is scheduled desludging, and Professor Mehta can give you a full scope of that. We're trying that in Vai. We're now trying that in Warangal as well. And it's very inclusive because, you provide services to every household, regardless of where they live. And it's a set rate, so you can't really charge more or less. And there's an assured market for the desludger. So it's kind of a win-win situation. But I said the first premise is you have to have the treatment infrastructure, which really is the responsibility of the ULB to create. Because otherwise, where do they go? They're doing their service, but they have no place to desludge. So they will find the nearest field. And there are so many stories of them being abused by the policemen, getting up at 4 in the morning to make sure that nobody sees them. Households feel bad about it. So regulation will only come once we have enough infrastructure, and there are some good models. And secondly, you have to make sure that the business, they don't go out of business, right? It has to still be sustainable for them. It shouldn't be beyond, like, you have to go 40 miles away to desludge. Nobody's going to do it. So it should be a great partnership, actually, eventually, between the ULBs and businesses, which is what I'm hearing is kind of the thing. How do we foster these partnerships so that businesses are sustainable and services are available to citizens? Because governments can't provide all that. So. But any other view, Sampath, on desludgers that you talked to?
Desludger is that not everybody wants to come into the radar, especially in the larger towns. You have to also realize this, which is something which we realized when we were trying to do something in Bangalore. Interestingly, in Bangalore, the outskirts of Bangalore, they don't want to come into the radar because, everything is a cash economy. And these are all local politician-funded cash economy. So we don't know. It's going to be an uphill task in what you are saying in terms of registering them also. In smaller towns, they really want a facility where they can come and drop. We have seen this in Narsapur, where this person is very clear that she doesn't want to. It's a lady who does this, and she doesn't want to go outside anywhere. She wants to come only to this place and drop it. But there are places where they say, no, I don't want to be part of this. So I think I'm not competent to answer this question at this point of time, but I think it's a far more complex problem than what I understand. I think that's the logic, I would say.
So I want to say a big thank you, and thank you to all of you for listening patiently to a subject on fecal sludge. Hopefully you all become advocates and create the right ecosystem among all of our partners, and especially corporate partners, to engage with us on this. Thank you.
Thank you very much.
Thank you, Madhu, and our fantastic panelists for such an insightful and engaging session. We now move on to the next panel and session of the day, which is the role of media in sustaining ODF. This session will primarily focus on the pivotal role that media will need to play as one of the biggest influencers of public opinion and critical behavior change influencer in sustaining India's ODF status post the 2019 mark. With this, may I now introduce you to the moderator of this panel, Mr. Santosh Tiwari. Santosh is the media head and senior director at FICCI. He has about 27 years of experience while working with organizations like TV Today Network, News 24, and Financial Express. Our first panelist of the day is Kaveri Bamzai. Kaveri is a seasoned journalist with more than 30 years of experience at India Today, the Indian Express, the Times of India. She